Supervisors. Mr. Smith, would you do the invocation followed by the pledge, please?
Right. Father, thank you for a day that's been given here in Grayson County to work your work here in this county. Thank you for your blessings upon this county, upon our leaders. Thank you for the Board of Supervisors that so diligently serve. We pray that you bless each one in the meeting tonight and help us to have a good meeting. For it's in your name we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all. And remember, tomorrow's is 9/11, so put your flags, half staff, and remember those folks. If you look over if you got time, look over the agenda, the consent agenda, I'll look for a motion to approve.
So moved.
Second.
Favor aye. Good. First is on our presentation, Dr. Karen Shelton. You're right on time.
Yeah, you're gonna be first, you gotta get credit for it. It's very good. Well, thank you all so much for having me this evening, for this opportunity to talk about COVID-19 and how it's affected our region and our county as well. There are some slides, she told me, that we had prepared, some slides.
Can you pull them up, Carl?
I don't know if there's a clicker, but so as we know, COVID-19 has been devastating for our world and for our nation, for our state, and for our region and county. And Grayson County, we've had well over 200 cases at this time, and unfortunately the numbers keep climbing. Somewhere we'll have some slides where we'll look at, we can see Southwest region in general has been on an increase over the last 2 months. So when we look at, that's fine. When we look at the Southwest in general, we were rather slow to start. You know, the rest of the state had a rather quick start, and a lot of regulations were put into place as far as stay-at-home orders and those sorts of things, non-essential businesses closed. And so we didn't have many cases around at the time, but as the stay-at-home order got lifted on June the 10th, and as businesses began to open, we also saw a phenomenon where we had more people traveling, summer vacationers, and Grayson County was particularly hard hit by events that happened in Galax. As you know, our cases in Galax started going up. We had our first cases at the end of April, and they began to go up from there. And so there was a very significant impact to Grayson County, especially on its eastern side and in the 24333 greater Galax area regarding its number of cases there. And they rose rapidly up through May and June. And then, at least for the Galax area, somewhat subsided after that. Grayson settled a little bit, but we just continued having cases, week after week, and it's kind of changed its form. What we find is that the highest risk situations are when it's in a household. Most of the people in there tend to get it. People who ride in a car together, also very high risk. Coworkers can have some risk, but we are finding for a lot of coworkers, as businesses are wearing masks and socially distancing and washing our hands, in our work settings, we're doing rather well. One of the newest phenomena is that we know that a lot of people who are coworkers are also friends. And so outside of work, they will tend to gather and be social. And we're seeing a lot of those effects as well. So as we'll talk a little bit about what can we do as a county to help stop COVID-19. But one thing that we do, and here you can see a little bit the effect of, this is actually a ballot slide that looks at the 21 county ballot footprint and shows the effects, how it was relatively low throughout most of the region. Again, a little bit of Galax and Carroll and Grayson accepting, and then started going up really in mid-July. So since mid-July, we've had a surge that's been a little different, as I mentioned again, with travelers, vacation, different things of that nature. So when we look at the effects of all these cases, we know that when it gets into a community, you can go ahead on down one more slide if you like. And this is just the trajectory for the Mount Rogers Health District. Like you said, like you can see, it just kind of keeps going up and going up a little bit more rapidly in the last 2 months. And if you go one more down, you can see Grayson and how it is moving along. Again, these scales are rather large as far as the left side going up to over 250 cases now, but on the right, you can see we're usually talking in increments of less than 5 cases per day. A few days we've had some spikes up higher than that. What happens though, when it gets into a general community, we find it gets into our workplaces, but then we find that also happens with our long-term care facilities. And that is really where we see some of the most devastating consequences. And in all of our demographics of 77 deaths across the district, all but 8 of those have been in people over the age of 70. So most all the deaths that we have seen in our district and in Grayson County have been in people who are over the age of 70. So we know it has COVID-19 has a great toll for the elderly, and also we know a lot more complications and sometimes unfortunately death as well for those with medical complications. As we look at Grayson County specifically, you can see in here our case counts continue to go up. Most recently, in the past couple of weeks, one of the long-term care facilities here has had an outbreak. And again, that is happening in every county of my district right now as we're seeing just more cases in the community. But what happens is, and they have been very vigilant, and they have been testing all along, and they're doing an excellent job. It's just that once it gets into the facility, because of the asymptomatic spread of this disease, it can go quite a ways through the facility before it's recognized by people who are sick. I've actually been amazed in our long-term care facilities, the number of those who actually will have no symptoms at all. The residents themselves don't ever have symptoms, yet they're positive. But on the other hand, as I mentioned, some unfortunately will pass away from the disease. So as we see, all of these numbers are somewhat interrelated. As we see more cases in the community, then we have more positivity in our testing, which is the second one. And as we see more outbreaks, which is reflected in the third graph, we see more cases as well. And you can see in the last one, the number of healthcare workers that get affected also begins to go up. So all these are rather interrelated as far as our community goes. So you can go on down to the next slide. So when we look at testing throughout the area, you can go on down one more slide, please. There is a site on the Virginia Department of Health. We actually did add in testing in Grayson County. Today was our first day of testing at the Grayson County Health Department, and we'll continue testing there on every Thursday. We do ask that people call for an appointment, mainly so that we can get all the information over the phone, all the demographics and things, so that when you come in, you don't come in at all. You drive up in your car and it's a drive-through testing. So we get all the demographics over the phone. You literally drive up at the time. They swab your nose and you drive away. We were very thankful to have, I don't know if it's the town police or the sheriff's department to come and help with the traffic today. Thank you so much. Appreciate that. With the traffic today, we had a small number, but we were able to do the testing, and we will continue that on Thursdays. We hate that we haven't been able to do it before now, but we've had personnel, and so we're working with that now. So,
Dr. Shelton,
yes.
You said you have an appointment, but you have to have symptoms, or can anybody just get an appointment? If I want to test, I just say, you know what, I feel like getting my brain scratched today. So
yeah, if you want your brain tickled, you come on in. Yeah, we haven't turned anyone away. So we say to call for an appointment, but it's really, like I said, really just to get the demographics so that we don't have to do paperwork when you're there. But we do ask about symptoms and different things just for our own knowledge. And certainly when we are scheduling these tests, I mean, if people are very sick, we don't want you to wait for a Thursday to come for a test. I mean, you need to seek medical care, perhaps through primary care or urgent care, if that is what is needed based on your symptoms and how sick you might be. But for those who have mild symptoms, just kind of want to know if you're a contact to a case, we still recommend testing at 5 to 7 days if you're in quarantine. That does not get you out of quarantine, but it will help us to know, earlier if you're turning positive. For those who are concerned, want to know, they're welcome to call and be tested. So the way that we do this is every case is investigated. COVID-19 is a mandatory reporting disease for Virginia. So every case is investigated. We call them, we go through their history. We find out when they were contagious. They're then put into isolation for 10 days from the onset of symptoms. And if they don't have symptoms, it's 10 days from the onset of test. We then talk to them about anyone that they may have been in contact with while they were contagious, infectious. And we figure out who are the highest risk contacts, who are the people who are at highest risk of having this disease. And that's what we do with our contact tracing. Those at highest risk of having this disease, we then put into quarantine. And quarantine lasts 14 days from the exposure, from the last exposure to the case. The reason for that is that the people at highest risk of getting the disease, if we let them continue out in the society, then in 5 days when they get sick, they've been contagious already for 2 days again. And so we have a whole nother layer of cases. This is where the turnaround time on testing is so very important. The quicker we can get back tests, identify those cases, put them in isolation, get their contacts in quarantine, the faster that we can slow the spread of this disease. You know, early on, we had hopes of stopping this disease from spreading at all, I think as a nation and a world, but obviously that's been proven that it has continued to spread. So if we can't stop it, our goal is to slow it. And there are many purposes for that. In slowing of this disease, which we have been able to do, in slowing this disease down, we've been able to have a bit more understanding about the disease. Some of the science behind it is a little bit, we don't have enough information still. I mean, we've only had this disease for 8 months now, and many diseases are studied for a lifetime, you know. So we've had this disease for 8 months, globally and nationally, you know, the science behind it, we're getting what we can, but we have gotten a little closer to some treatments. We do have antivirals now. We have some, you know, for those who are the very sickest in the hospital, they have regimens and treatments whereby people can recover better and faster. We also need to slow the spread of disease so that we do not overwhelm our hospitals. We want to make sure that they have capacity to take care not only the sick COVID patients, but also all the other patients in the community who need a hospital care anyway. So we also have been able during this time of slowing the disease to get more PPE so that our first responders and healthcare workers and other people can all have more adequate protection to keep themselves safe. And we're buying time to get a little closer to the vaccine. We're hoping and praying for the day of the vaccine, and it's getting closer. We're still waiting to make sure that it's a very safe vaccine. And we want to have all the safety parameters and knowledge on that vaccine before we give it. Nonetheless, we are making preparations, and we'll work with your county officials and emergency coordinators to make sure that as it rolls out, it will be a vaccine that is regulated. It will there will be priorities that are set by the federal government and by the state as far as how those at highest risk getting the vaccine, and then going from there. So we'll be working with your county to identify those within the county who may be a priority, and we'll be working with that. So it's been a long journey. It's not over. We still have a lot of work to do. You know, what are the things that we can do as a community to make it better? I wish I could tell you, you know, X, Y, and Z, and we'll have it taken care of. But unfortunately, we're left with the main mantras of wear your face mask, socially distance, wash your hands, clean your surfaces, and stay home when you're sick. You know, those are kind of the main things that we have at this point. There are some other tools, and if you want to go on down the slides just a little bit more, there is an app you can put on your phone. Honestly, in rural communities, I don't know, but I challenge everyone if they want to do COVID-wise on their phone. It's not a tracking device. I know there's been a lot of controversy and people have their opinions, and that's fine, but it's called Bluetooth technology, whereby if you are in a close proximity to someone for closer than 6 feet for more than 15 minutes and they turn positive, they can act, everybody has to have the more people that have the app, the better it works. So if you're around someone who turns positive so if I'm the person that turns positive, I have to activate my app and say, okay, I've turned positive, and I'm given a special PIN number to put in it that activates it. And then through this Bluetooth technology, it can say who's been within 6 feet. I have to say what day I was contagious. And then it takes that information and just gives a signal to the other people who have this app that they were around you on those days. My daughters are both in college now, so it's a big thing on the college campuses. She called me over the weekend and said, I got these notifications on my phone. What does it mean? I said, well, if it didn't tell you to put in quarantine, then you weren't a very close contact, but it means that you have probably walked by someone who turned positive at some point. But like I said, there are low risk exposures and high risk exposures. Low risk exposures, walking by someone, you're very low risk to get it. If you're both not wearing a mask and the one coughs, you can get it. But if people are wearing their masks and walking on by and not lingering, you know, there's a low likelihood. And again, I mentioned the things that make you high risk: closer than 6 feet, more than 15 minutes, not wearing face masks, you know, if you're sick, touching a lot of things, you know, all those things. So it's for the hand washing something. So this is an app that's out there. And if you could go to the next slide, please. One thing that we have noticed is that we do have a lot of outbreaks in churches. And we do encourage people to have their religious gatherings. We don't want to discourage the churches at all. We just want the churches to do things very smartly, you know, wearing masks inside, which has been recommended, keeping the social distancing, making sure that people have opportunity to use hand sanitizer. And I saw it wonderfully displayed as I came in and used it twice on the way in here. So thank you for that. And then, you know, just a few things. And we have put out a press release regarding, again, we encourage people for religious gatherings. This is a great time when we need to come together with our faith. But, you know, we just want people to be able to do it safely. And on the last slide, you know, some things again for businesses, and generally if we have a case, we always talk with the case, you know, where do you work? Have any of your coworkers been exposed? We generally work closely with our cases to get permission to talk with their employer, because we do find it is very important to talk with businesses regarding their safety practices, helping identify coworkers who may be high risk, and helping businesses along the way to put in the safest practices within their business that can help protect their coworkers. So there's a lot of information on BDH site, as well as Department of Labor and Industry is now involved as well. Next slide, please. And so, like I said, I wish there was a magic bullet that we could make this all go away, but we do have just as, like I said, the main things that we could do. And if you could forward to the next slide, please. There we go. Like I said, it's only the things that we have that we can do as far as wearing your mask, socially distancing, you know, washing the hands, hand sanitizer, stay home if you're sick, and then clean and regularly disinfect things, monitor your health, and then one word about the flu vaccine. You know, COVID is a respiratory disease and the flu is a respiratory disease. So it's going to get really messy here in another month or two as the flu begins to come out, distinguishing between the two. Certainly if you got both at the same time, that would be very consequential potentially for your health. So the one thing we do have is the flu vaccine. It's not a perfect vaccine either, but it does help. And so we highly encourage everyone to get the flu vaccine this year in advance of the flu coming, and in preparation to try to keep COVID as at bay as possible. As far as the county government, things that you can do, I mean, as this has unrolled across the state in areas where there has been very high transmission, the Virginia Department of Health Central Office and the governor have said that each county can make its own regulations. I don't know that the governor is going to put us all back into phase 2 or phase 1 at this point. So if the county feels that it's experiencing an undue burden of disease, it can choose to do things. Most commonly in Eastern Virginia, when they began to have a rise, especially middle tourist season, you know, they closed down the bars at midnight. That was their answer. I don't know that the bar scene in Grayson County needs to be closed at midnight, if that will have a great social impact or not. You know, in college towns, a lot of them, you know, are allowed to have gatherings of 250 people now, and a lot of the college towns, they have regulated their gatherings to 50 people. You know, I don't know in Grayson County how many large events you have. I know all the festivals got canceled this year. So, you know, when I talked with them, with the central office and thinking, what can we do specifically here? I said, you know, our greatest gatherings are religious gatherings and family gatherings. And I'm not going to stop those. You know, people have to live their lives. They need to have their religious gatherings. They just need to do them smarter. And we need to have our family gatherings. We just need to do them smarter. So kind of what you know, if you think that there's something in the county that you feel that you would like to do, by all means, we can discuss it. Certainly promoting amongst your businesses, you know, the face masks within the businesses, continuing with the, you know, all the things that we talk about, it's redundant. But if there are other things that you would like to propose, we certainly would be happy to work with you. We are working with a media campaign with the state for Southwest Virginia on meaningful media for us as far as what would make a difference or an impact in our communities. Again, not looking to stop family gatherings. I mean, They have told us that protests and religious gatherings are protected under the Constitution, and I hold by that. So by all means, like I said, we need to gather where we need to gather. We just need to do it smallly and slightly. So that's a lot of information. I don't know if you have any, you did have a one page in your packets that kind of go over a little bit of some of the details about margins and just in general. And it talks a little bit about the age ranges and the different risk factors that we've seen associated as far as risk of hospitalization and death. And then it does talk a little bit about Grayson County specifically as far as your cases, kind of ongoing and things there. Any questions for me?
Is there any change to the flu vaccine distribution as far as, procedures, given that you've got COVID testing going on also? Is there, so same as usual?
Yes, the flu vaccine is still available at the local health department. We are still working with all the schools within the district regarding flu vaccine. We should traditionally go into all of our schools throughout the district. Grayson County has in person. So do you also have a virtual option in your schools right now? So we have what we have traditionally done, and I have not seen the schedule, but I know that our schedulers have worked with the schools regarding the schedule to come into the school and do vaccine in the school for those who are in person, and then provide a separate time where those who are doing virtual learning can come in, like 2 to 7 p.m., to sign up and come in that fashion.
And then is there any anticipated shortage of the flu vaccine like we've seen in previous years?
I've not heard of any signs of shortage for flu vaccine. I know that they're really trying to ramp it up for this year and make sure as many people as possible can get
Get it
vaccinated.
early.
Yes,
wait.
I would recommend getting it early this year. I'm kind of I probably shouldn't say this as a public health official, a late flu vaccine giver. I try to get my 2 weeks before Thanksgiving because that's when my risk starts, with all the families and whatnot. But this year, I want to get it early because it's, we're going to have COVID vaccine to look to. And so I would get it. It's, I think, available, I'm going to say now at the health department, but probably, I don't know exactly which day they're rolling out. It's available. You could please call if you're interested at the health department. We do greatly rely on other community partners for getting out the flu vaccine as well. But we do have the flu vaccine at the health department, and we will be working with the schools.
Great, thank you.
That was my question. When do you recommend everybody getting their flu shot?
Yes.
For everything.
Well, like I said, the flu vaccine is not perfect. I wish it did a better job. But what I always tell people with the flu vaccine is if you get it, you'll be less sick for less long, and you're less likely to die. People die from the flu every year. More people actually die percentage-wise from COVID, but more people get the flu. So more people actually die from the flu, proportionally wise. So, if you get the vaccine, you're less likely to have severe repercussions from the flu, even if you do get it. So maybe not be perfect, but it is something. And we'll take that right now.
I got one question. Those COVID alerts, is there any kind of fraud? Can somebody like a factory say, I've got COVID and puts the whole factory in quarantine? Is there some kind of precaution that would happen?
You mean on the phones or just in general?
Well, say on the phone, you said that, you can put in there that I've got.
No, we have to instruct them and give them a specific number. It's done. So all positive cases come to the health department. So we have to have a copy of that positive lab test before we do anything. And so whether it's on the phone or whether it's alerting a company, we validate these lab tests before we make any large moves at that time.
They can't go on there on their own and say, I have COVID-19, and then they quarantine the whole building.
No. And same, like, I know we've had a lot of reports, and as we've worked with businesses over the last 7 months, people say, I got COVID, and then we talk with we don't have a test result for this person, so, we've been working with the businesses, along the way.
It's a pretty slick little app. I downloaded it about a month ago, I guess, or not long after it came out, but it's pretty slick, and not much to it. And so I think it's a great way to try to leverage the technology to help make people aware.
What's the turnaround time for the testing you did today?
So the tests that we do through the health department are sent to the state lab, BCLS. Our turnaround time is about 4 days. We wished it was close sooner. So today is Thursday. We should have the results on Monday.
Thank you for everything you've done.
Absolutely.
Most welcome.
Any other questions? If you would stand for just a second, Bill, Mr. Shepherd.
Thank you, Mr. Chairman. I wanted to say that I started my career in the health department in New Bern, North Carolina, a long, long time ago. And throughout my career working with hospitals, we had to interact with the health department on a frequent basis in order to coordinate the whole continuum of healthcare. And I can say this with no reservation, Dr. Shelton is the best. Southwest Virginia is really lucky to have someone like her working with us, particularly at this period of time. And we just want you to know how much we appreciate you and all that your team does. We have something special for you.
Oh, well, thank you. That's very kind. You all have been wonderful to work with as well as a community, and I do appreciate everyone.
I'd like to read this proclamation. Proclamation of the Grayson County Board of Supervisors in recognition and appreciation of Mount Rogers Health District and Dr. Karen Shelton. Whereas the coronavirus 19 virus pandemic has swept the nation over the past 7 months, and whereas the Commonwealth of Virginia has suffered significant health complications due to the virus, and whereas the county administrator of Grayson County has declared a state of emergency for Grayson County, and whereas the Mount Rogers Health District has been responsible for providing guidance and assistance throughout southwestern Virginia during the crisis, and whereas Dr. Karen Shelton, the director, has led Mount Rogers Health District throughout the pandemic, now therefore be it proclaimed that the Grayson County Board of Supervisors hereby recognizes that Dr. Shelton and the employees of Mount Rogers Health District have provided outstanding assistance to Grayson County throughout the pandemic. Now therefore be it further proclaimed that the Grayson County Board of Supervisors wishes to acknowledge the dangerous and outstanding work of Mount Rogers Health District under the leadership of Dr. Karen Shelton, and on behalf of the citizens of Grayson County, we wish to express our sincere appreciation. Adopted this 10th day of September 2020 in the county of Grayson, Virginia.
Thank you. That's very special. I look forward to sharing this with my staff, because they really are the power behind everything we do.
Absolutely.
Thank you so much.
You're welcome.
Good. Next, we'll
Need a motion to adopt it.
oh, yeah, I did. Before, since it's proclamation, we need roll call.
Proclamation.
Okay,
The ordinance or resolution, not proclamation.
that's great. Look for motion to approve proclamation of Mount Rogers Health District.
So, second.
Second, all in favor, aye. All right. Thank you for all you done. Next be Mr. Paul Holt, First Service Coordinator for Education.
Thanks, Supervisor Belton, and members of the board. I just want to take a couple moments to update the board on the activities of our emergency services organizations and providers for the month of, or since the last board meeting. There we go. So look at the EMS synopsis. We had 207 calls for emergency medical services during the month of July. Of these 207, 145 resulted in transport. So basically 3/4 of the time somebody calls 911 in the county, they end up going to the hospital. Of these 207, about 21% resulted in mutual aid calls. So that means that the primary agency required assistance from one of our partner agencies to be able to meet the requirements for the call. We had 26 calls where the primary agency was not able to respond for one reason or another. And again, we rely on mutual aid to meet the deficits there to make sure we get our people taken care of. And then we had 17 calls that required more than 30 minutes to get it on scene. However, of those 17, 8 of those were mutual aid, which means that the second agency going in. So if we take that and look at just the primary agency response, or then we were basically about 4%, which is well within our 90% cutoff that we shoot for. On the fire side, we had 6 structure fire calls. That's not 6 individual structure fires, 6 times that the fire services were called out. We had 1 brush fire, 1 vehicle fire, and then 5 other types of fire, electrical, utilities, that kind of thing. We had 9 mutual aid assists from the fire service to the EMS side. We had 14 motor vehicle collisions, and that's pretty standard for summer activity in the county. And then we had 7 other calls. Those range from missing persons to water rescue. All of our calls are important, and I think any of our citizens who have requested assistance by the fire department or the EMS agency would agree. We did have 3 major calls, 3 calls of significance that were kind of above and beyond. On the 8th of August, we filmed out for a water rescue down by Duck Roost, awesome name, and that was for 1 victim. By the time the fire department from Independence and the rescue squad from Independence got there, they turned into 4 victims, 4 different rescues, not 1 rescue, 4 victims, 4 different rescues. So that was coordinated by Chief Ash and his people, and the rescue squad folks did an outstanding job there. It was something that was escalating as fast as we could be there, and still kept it under control. Got all 4 victims to safety, 1 of which was transported to the hospital. On the 9th of August, the next day, basically, we had the Sparta earthquake. We were very fortunate. We had very limited damage in the county. We did have some damage to school properties. We had a couple of private residences, some moderate or some minor damage. And we had a couple, or 1 vacation home that had some minor damage. And then the town has also found some damage subsequent to our initial damage assessment with the water supply system they're addressing now. We appreciate BDM coming in and assisting us with the damage assessments on that and make sure we get everything documented properly. And on the 15th of August, we had the flooding event that impacted the Freeze school heavily. Primary agencies of that were Freeze Fire, Freeze Rescue. The Freeze Public Works Department was very helpful, and then we had the VDOT. Grayson County Public Schools obviously was heavily involved in that, and BDM so those were the major calls of specifics. I'm not going to spend too much time talking about the COVID, because Dr. Sheldon pretty much covered that. So, and the daily monitoring and the sit reps, we're continuing to do those things. We're spending a lot of our time working through the PPE issues still, and we will continue to do that through the duration of the pandemic. We are doing the bulk of the ordering for PPE for the county through my office, and then we distribute to the appropriate agencies and organizations. Most recently, we're in the process, we just delivered our first order to the public library here in town, so we can get them back up in business also. We have also initiated a project with the governor's office, a health equity pilot program, whereby we're going to end up with a lot of materials, about 3,000 units of hand sanitizer and masks and public education materials. We're going to go ahead and get that material out to the communities through outreach programs. We're working on the initial processes for that right now, and we'll be happy to advise further as we get further into it. We did do a outreach on the 26th of August with our migrant camp communities to make sure they had the supplies they need and the educational materials they need to take care of their folks. And most recently, the nursing home here in town had a problem with medical supplies. And obviously we can't provide those, but we were able to engage them with the appropriate people who do have those resources, and they were able to get those within 24 hours, so that was done. Some program updates. We started a strategic planning process for the emergency services, primarily involving the commission. We have 2 new working groups under the commission, a fire group and an EMS group. They're working on that process, and we anticipate having a strategic plan for emergency services for your review probably in the January timeframe. The fire and EMS training, obviously training is taking a significant hit because of the pandemic. We are doing classes again now on a limited basis, and we're being very careful with it. We have requested some 6 classes from the Department of Fire programs on the fire side. A couple of those classes will also be applicable to our EMS providers. And then we also have the EMT class going on with Ms. Barnes in Rugby right now. I think the last, we still have 19 people in that class, so she's doing an outstanding job there. We are in the middle of, or actually the beginning of the coup planning process. BDM brought on a contractor at their expense to assist rural agencies in their jurisdictions with coup planning or continuity of operations planning. And we volunteered to be a guinea pig for that process. And we actually had our first meeting last week. And we have the next meeting. We actually have a workshop coming up on the 16th where we'll start working out the plan. We're working with the health department right now on the health fair in October. We've acquired 3 volunteer Spanish translators for emergency services folks for when they need them. We've started the quadrennial EOP revision process this month. We just completed the EMPG grant. Actually, I got one more document that we received by email today. As soon as we get that out, that process is completed. And we also closed out the hazmat call from June 12th. We got all of the materials and monies that were expended for that call were reimbursed through insurance and through the contract with that. That's pretty much all I have.
Paul, I'd like to elaborate a little bit to the board of supervisors about that call. And even though we're volunteer here, I think you were impressed with what you came on when you got there.
I was very impressed. One of the things that you worry about when you leave a city where you have 2 regional hazmat teams, state hazmat teams within 30 minutes. I come out here where the regional hazmat team is probably 2 hours. And with a hazmat incident, most of the time it's extremely time sensitive because you have to stop the product from entering the environment. And so when I got the dispatch on there, when I got toned out on it by 911, I honestly anticipated I would get there and we'd have a lot of people standing around waiting for a regional hazmat team to show up. When I got there in about 30 minutes, what I found was that Independence Fire, Rugby Fire had already done what they could to stop the leak at the source. This was an overturned corn picker. Now they could not put themselves under that vehicle, it was unstable. But they had done what they could to stop the effluent from coming from the tanks. They had blocked the culvert where the material before they got there had already entered the waterway. They had created an underflow dam, which generally in training takes about an hour to do. They'd done it, well, somehow they did it before I got there, so it was less than 30 minutes, and it was effective. And they had 4 boom sites set up downstream in the waterway. So I mean, it was a textbook. The job was just very impressive. I'd hold it up against any regional hazmat team. When Scott got there, when our VDM representative, our hazmat representative got there, he was like, "What are you going to do? Everything's pretty much done." So we contacted the contractor and helped the contractor engage with the responsible party and pretty much it all taken care of. I also want to kind of throw a shout out to the insurance folks who dealt with this, because the way they did the billing on it, instead of every agency having to document individually each piece of equipment and each hour expended on this individually, they allow us to do one report from the county. We submitted to the contractor, who essentially just added all that then to their bill, and the contractor backfilled our supplies and everything. So it's very efficient, much more user-friendly process than I anticipated. So I'm very proud of the guys and gals that were out there. Hope you are too.
Great.
So I'd just like to add too that it's a pleasure to work with Paul, and I guess I realize every week when we sit down and talk most weeks for a few minutes there, I realize the value that we have in the training and the experience and having him here in Grayson County. He's a great asset. And I probably recognize that as much as anybody because of the closeness and how we work together and all. And we've got a true asset here in Grayson County. And I just wanted him to give a report and then talk a little bit about what he's seeing out there too, because I think it's impressive for a volunteer group in Grayson County and what we still have going on here.
Thank you.
Thank you, Paul.
Thank you, Paul.
Mr. Chairman, one thing, I mean, since National Preparedness Month is coming up, you know, I think we'll do a proclamation on it, but I mean, in this particular case where we have something that's not normal, I mean, they're trained for it, but hazmats don't occur every day. Is it something that we ought to recognize those two departments for their professionalism?
I think that's good.
Yeah. Because they did, I mean, they did what they were supposed to do, but
Right.
it's not the same as answering a call that they're routinely do.
Yeah.
This is something that doesn't happen
I think that's good.
Do you want to do the other proclamation now?
Sure.
So, national preparedness.
Yes. Proclamation of the Grayson County Board of Supervisors in support and recognition of National Preparedness Month. Whereas National Preparedness Month creates an important opportunity for every resident of Grayson County to prepare their homes, businesses, and communities for any type of emergency, including natural disasters and potential terrorist attacks. And whereas investing in preparing ourselves, our families, businesses, and communities can reduce fatalities and economic devastation in our communities and in our nation. And whereas the Federal Emergency Management Agency's READY campaign, the Ready Virginia Outreach Program sponsored by the Virginia Department of Emergency Management and other federal, state, local, tribal, territorial, private, and volunteer agencies are working to increase public activities in preparing for emergencies and to educate individuals on how to take action. And whereas emergency preparedness is the responsibility of every citizen of Grayson County, and all citizens are urged to make preparedness a priority and work together as a team to ensure that individuals, families, and communities are prepared for disasters and emergencies of any type. And whereas all citizens of Grayson County are encouraged to participate in citizen preparedness activities and are asked to review the READY campaign's websites at ready.gov or listo.gov to become more prepared. Now therefore be it resolved that the Grayson County Board of Supervisors hereby proclaims September 2020 as National Preparedness Month and encourages all citizens and businesses to develop their own emergency preparedness plan and work together toward creating a more prepared society. Adopted this 10th day of September 2020 in Grayson County, Virginia.
So, for a motion to approve that proclamation. Second. Wait, Rob.
Aye.
Right. Next on presentations, Ms. Warwick.
My name is Laura Witt, the Executive Director of the Grayson Chamber of Commerce. I just wanted to come out and kind of update you guys a little bit about what we're doing this year with all the crazy stuff going on. I'd like to begin by saying that the Chamber takes great pride in representing Grayson County. The Grayson County is admirable, and the Chamber plans to do whatever we can to continue that progress and growth. I just started that chamber in April, and we've had 16 new members, and we're growing every week. We're currently offering 20% off of our membership investments for the remainder of 2020. So, you know, of any businesses that are interested in joining, just let them know that we're offering a promotion right now, and they can come and join. So earlier this summer, we launched our first ever 1540 program, which highlights professionals under the age of 40 from the counties. So the public voted, and we had about 33 nominations. And then we created a committee who got together and chose 5 people in the 3 localities, Grayson, Carroll, and Galax. and those will be announced here pretty soon. And we're also going to invite them to our annual chamber member dinner. They'll be introduced, and then we'll spotlight them in the Carroll News, Galax Gazette, and the Declaration. We did have one networking event in July. It was in Galax at Senior Home Share. We had about 30 people in attendance. We're planning on doing another one next Thursday at the chamber office. It's going to be outside. We're going to follow CDC guidelines and social distance. We'll have hot dogs and bag chips, so it'll be super easy for them to just grab their food and just kind of walk around and network and social distance. So if you guys are free, we'd love to have you guys come out and see the chamber office at our new location in downtown Galax. Networking events are a chamber member perk, but we like to do them. So if you know of any businesses or owners in the county that would like to show off their business or have an event, we would love to help them do that and just kind of showcase them. We're working on growing our board of directors and our mission-specific committees. We have several committees to choose from to serve on. If you're wanting to get involved with the chamber and you want something to do, you can let me know, and I can kind of let you know what your options are. If you think of any new committees or anything that we should be doing, we're open to suggestions as well, so just let us know. We're working to diversify our board of directors and our committees through the town of Independence and the town of Breeze. So yeah, like I said, we're just looking to grow. So if you have any joint ventures or joint committees that you're interested in, just let us know. We are hosting a golf tournament fundraiser in Galax at the Blue Ridge Country Club on September 25th. Just a little bit about that. It's going to be a 4-man team, captain's choice, shotgun start at 9 a.m. It's $200 per team to enter. So if you know any golfers, we'd love to have them sign up. We're also taking hole sponsors. It's $100 to sponsor a hole. And first place prize is $1,000. Second place is $300, and third place is $200. So it's a pretty good prize. And then we'll also have closest to the pin and longest shot prizes as well. So if you're interested in more information, you can visit our website. It's just WayneCountyChamber.com. And I also wanted to mention that we do ribbon cuttings. I just had my first one in Galax at Galax Extreme Fitness in July. We had a pretty good turnout. The Gazette came and took some photos and did a feature for them. So that's something free to any business. We take care of all the supplies, the media, and everything that comes. We take care of all that. So we would love to host one if you know of any businesses that are just looking to revamp their business, want to do a grand opening or a reopening. So yeah, that's all I have. If you're interested in becoming a member or becoming involved, just let me know. We look forward to planning new events here in 2021. Does anybody have any questions for me?
Can you business join online?
So it's basically just a form that they can fill out. I believe it is online. And they just fill it out and then they email it to me. And then I can send an invoice and you can pay online. Or they can send a check in or however they want to do it. And also can come and pick it up too if they prefer to do that.
Okay. So that is accessible.
Yeah. If it's not, I can easily get it on there, but I'm pretty sure it's accessible online. But I'll double check that.
Was Chief Wagner the one to come up that half of the hole?
Yeah, he was. He's a cheapskate. Just kidding.
The CO's big for this. Big here tonight.
Does anybody else have anything for me?
Thank you.
Thank you. I appreciate you guys.
All right, President, I think Grayson County is very fortunate to have people like Michelle and Mr. Hall, and very proud of Laura. She's not been there long, but she's done an outstanding job for the chamber. So I appreciate you.
Thank you.
Hey, we have no public hearing for tonight. Business, fund designations and transfer requests for Baywood Trade. And take the center we didn't get this last month. Yeah. So I look for a motion to approve the fund designation and transfer.
Second.
All in favor, aye.
Aye.
Okay, next under old business is Comcast franchise agreement.
Mr. Chairman, I recommend we table that.
Second,
Second.
on favor aye. Okay. New business, emergency purchase of public works.
Yes, Mr. Smith?
Okay, you all have the letter there. You see the situation we're in. Bottom line, we are in an emergency situation there with our trucks that pick up trash. You see in the letter where we're basically taking a recycle truck out of a cycle to at times pick up this trash. This Mack is an older truck and has a lot of miles on it. And basically it's dollaring us to death is what it's doing. To the point where the guys have basically said, you know, we feel like we need to make a decision to take this truck and put it in the back of the line. We're not saying get rid of it, but we're saying put it in the back of the line. Instead of being a primary truck, it needs to at least be in the secondary slot as a reserve. So that's the situation we're in. And Mr. Looper has come and presented to me, and then we sat down with Mr. Shepley and looked at this situation. We realized that we have frozen our money, our CIP and different things. And but we have evaluated the situation. I felt like it was obvious that we needed to do something, so we came and sat down with Mr. Shepley and basically got the green light to proceed with quotes and get to the place to work that we are today. What we're looking at and the money that's needed. And we are applying for USDA. That USDA, our finance officer is working to get a USDA loan grant type where we can make this purchase and go forward with county and public works in a feasible way. And so that's what we're asking tonight but this board to consider is to let us proceed in freeing up the money from the contingency fund. Basically, to make the purchase, we'll go through the USDA loan grant process, and then once that is approved and comes back in, and Ms. Gayhart has been working with them. There shouldn't be no hang up or no problem there at a good rate of interest. And once we've done that, then we could put this money back into the fund and CIP and even back in contingency if need be.
Is that allowed? So, I mean, you're gonna buy it using county funds because it's an emergency. That's what you're asking for, right?
Yes.
But then the next piece is you're gonna pursue a rural development grant / what?
We already are.
Is that allowed if you've already spent the money, if you've already committed the money? Using internal funds, is that allowed to then pursue a grant to reimburse yourself?
So let's get Lisa in to give the details.
Does that make?
Yeah, it does.
Yes. Yes, sure. I understand that. We can. I'm not being as much on that piece as I have with
Yeah, because I get the emergency piece.
Yeah.
But when it says at the bottom that we're going to pursue a grant,
Yes.
Grants aren't really emergency in nature. So.
Not filling in the gap, something you already did.
Right.
I guess.
I mean, I understand the problem. So I got that.
Right.
Right. I just want to make sure that we're saying what it says is that we're going down an emergency and we're going to pursue a grant. It doesn't really say that we're going to buy it. Then we're going to go pursue a grant for reimbursement.
Right.
And I don't have a lot of experience with grant. The question is, if you've already spent the money, can you then pursue a grant to reimburse?
Sure.
I don't know how a grant even could do that.
Yeah. I asked Lisa that question, not precisely the way that you just did, but you reassured me, Chief, are you? Okay.
They're working on payroll. And I have,
Thank you, Aaron.
Thank you.
You're welcome. Drive carefully.
Thank you very much. Thank you all so much.
Supervisor Fan, I have.
So Lisa, here's the question. So the memo, at the bottom of the memo, it says, you know, we have this emergency. Here are the two options. And then it says we're gonna pursue a grant for the money. What was explained is that we're actually gonna commit county funds. The recommendation is to commit county funds to buy the truck and then pursue a grant to reimburse the county for the money that we spent. And that, again, like I just said a few minutes ago, I don't have a lot of experience with grants. But if you've already committed the money, I don't know that how favorably a grant giving agency would look at that application if you had the wherewithal to be able to do this, spend the money in the first place. Does that make sense?
I do understand your question.
Yeah.
The time sensitiveness with these bids only being active for a certain amount of time and the emergency situation of the purchase would make it more necessary to use county funds before we get the grant funds, grant/loan funds. This grant process is actually already in the process. We've already had a public hearing on it. It's for the sheriff's office vehicle. So this is we'll be pursuing funding for the U.S. Department of Agricultural Rural Development Funds.
Yeah, correct.
So a lot of this could be grant funds and then it could be offset with loan funds through the same program that we have done prior.
But if we are committing 250,000 average now,
Yes,
is that gonna hurt us in the ability to get grants
no,
for this same project?
no, sir, it will not.
I think you've already been working with the USDA representative
I have.
on this.
Yes, and he was concerned with our original process that we didn't have enough purchase. And he's the one who actually led me on, gave me this idea of, hey, can you combine something else with this to make it a more solid grant? Because at the time that it first started, we didn't have enough outlay to actually fulfill the grant necessarily. It was only a portion of it had been met. It's a $90,000 minimum, and we needed to purchase something else anyway. This is just fulfilling that need. Instead of fluffing it, we're actually fulfilling a need.
But they're okay with going ahead and buying it, even though we're not finished with the application?
Yes.
Okay.
Yes. Does that answer your question?
And Mr. Looper has arrived now, and thank you, Lisa.
Sorry.
And that if you have any questions, hopefully I explained the need of this truck and why and all, but if you have any, he can more adequately talk about it, I'm sure.
It's a situation that we wouldn't have brought to you if it was just it would be nice to have type situation. It's really truly approaching an emergency situation, and we wanted to stave that off before it actually occurred.
Did you want to speak, Mr. Luke?
Yes, Lisa. Hey, can you hang
If you
up?
climb the step, come up here.
Well, I was shocked whenever I really I talked to Lisa about the charges we incurred in the last, since the first of the year, the budget started. And I told Lisa that I was confident that we'd spent 25,000, and we had on one truck, we spent that much. And then I've got invoices here for $13,375 additional charges, not on the same truck, but on a different truck. So basically what I need to say is our trucks are aging, and the service manager at Worldwide in Abington, where we get this work done. This is a 2013 model truck, and he told me that it had exceeded its lifespan. I said, you can't, I said, it's our second newest truck. He said this truck is done for, and it, you know, it's got 203,000 miles on it, but of course you can't go by miles because trash truck miles are, they're just not interstate miles. So that whenever he told me that, I knew we was facing an uphill battle on this thing, and it's not going to get any better. These things don't heal themselves.
But if you've already spent, what would you say, 40,000 on your maintenance budget?
On this truck, it's been 23,000.
Correct, but total, what you said in the last, I think, 3 months since the budget came into effect. If I
That's
heard what you said, you spent about $40,000 on maintenance.
Yeah, and that's just on these. That's not total maintenance.
Half on this one truck.
No, I got it, but you're asking for a new truck, okay, that's gonna solve one problem, but do you have a maintenance budget issue now because
Yes.
of the expenditure?
No doubt, yes.
Is that something else you need us to address?
Well, I don't want to get you all at the same time.
Appreciate that. I mean, it's not necessarily an emergency, but it's that, something that needs to be.
I personally think we ought to wait till after the first of the year to see kind of how that first 6 months works out. We could recoup a little bit, or we could get worse.
That's fine. That's good. I'm just, it sounded like to me that you've.
Just be ready for it, because it is coming, no doubt. It will be
Say
coming.
no.
Well, I figure if Jonathan can't fix it.
I know, that's right.
Well, I don't,
It's amazing what they do with
Or
the
your
equipment they have.
guys, you
Well,
know, guys.
ironically, he called me today, and it's broke down again. It's in the shop right now. So, we can't run it tomorrow, so we are juggling, large item pickup, which starts in 2 weeks.
Week after next.
Weeks up here on Monday.
No, but it's the Wednesday route.
Yeah.
We don't start back with Mondays.
Yeah, it starts on Wednesday's route, but it actually starts on Monday, 21st. If I don't get, and I know this is nothing y'all, I'm just telling you the flow of how things works in our department. We've got a truck in Winston. If I can't get it fixed, I'm gonna be really in a bind to get large item pickup.
What's the turnaround time? If we approve tonight,
45 days. He guaranteed me October the 15th. He said I can possibly have it October 15th, but it'll, I can guarantee you 100% on October the 30th. So he said if I give him the PO as soon as I could, he's holding the truck and he's got the body ready to, I mean, it's not made, but they're ready to start building.
You could put that PO in tomorrow though, if the board chose to.
Yes, that would be, if you all see that we can do this, I would like to have it tomorrow, sent to him, and that way he can start the process. And of course, we have to go out and inspect, or I want to go out and inspect it. I've learned to do that, and make sure that it's what we need, you know. So that'll be another few days of holding them up before they paint it, before they mount it, stuff like that. So, but anyway, just for y'all's information, we've got a 99 model truck that's 20 years old with 900,000 miles on it. This truck's got 203,000 miles on it. We've got a 03 model that's got 300,000 on it. We've got an 08 model that's got 250,000 on it. We got a Peterbilt that's just 15,000. And then we got our old standby that's got 2.3 million.
I just want to make a motion to approve it. As soon as we can.
Your second,
Second.
all in favor, aye?
With the protocol.
Thanks, Jonathan.
Yeah.
Thank you all for helping us service people can.
And next will be the non-discrimination policy.
Yes, Mr. Chairman, this is a policy that we renew every year. It comes from the DHCD. And it's coming to us because of Eagle Bottom Phase 2. And what I need is, I need a vote from the board in order for me to sign it and continue to pledge that we will follow what's being described in that particular non-discrimination policy.
CDGB.
Pardon me?
What is CDGB?
Community Development Block Grant. We do this every year, don't we?
Yes.
I'll let you run down and find it. We'll see. It's good with phone. Okay, motion to approve the policy.
So moved.
Favor, aye? Ms. Reynolds?
Yes.
Did you hear that one? I couldn't hear if you voted.
Oh, yes, I did. I voted aye.
Okay, I'm scared. Sorry. Next, we United Way around understanding.
Yes, Mr. Chairman, this is just something that the United Way is sending out to all the counties throughout the country. And it's basically talking about how United Way interacts with county emergency preparedness during the coronavirus crisis. And they're just asking us to review and approve the memorandum of understanding on how we will interact with each other during the COVID-19 virus. And we feel very comfortable with what's described in the MOU. And we're looking for you all to support signing.
Motion to accept. Second. All in favor, aye?
Thank you.
Next, question, public hearing. This,
Yes, Mr. Chairman, this is, on the surface, appears to be a little bit confusing, but I've asked our finance person, Lisa Gayhart, to come in and explain. This is a unique situation connected to the second round of money that's come into us from the CARES Act and its effect on the overall total budget. And it triggers a response that we need to do. And Lisa's going to read you that. Or maybe she can up there. Okay. So Ms. Gayhart.
As you're aware, the Congress passed, the president signed, Congress passed and the president signed the Coronavirus Aid, Relief, and Economic Security, or CARES Act 2020. This act provides funding for a number of different programs to address the COVID-19 pandemic. A primary component of the CARES Act is assistance to local governments for the direct impact of the COVID-19 pandemic through the establishment of the Coronavirus Relief Fund. Grayson County has been allocated an additional $1,356,678 based on population, including the population of towns within the borders of the county. These are funds should be considered one-time money and should not be used for ongoing services and for base operations. However, the use of these funds will significantly change the fiscal year 2021 budget as previously advertised and approved. Therefore, I'm requesting the County Board of Supervisors hold a public hearing to amend the FY21 budget to include the second and final allocation of the CARES funding. Do you have any questions?
Yeah, I thought we talked about this the first time around,
We did.
and there was not a requirement to put it in our budget. We purposely did not want to put CARES Act money in our budget because it was one-time money and it could only be spent on certain things. So what has changed?
Okay, remember that our budget includes different funds. Anytime that we have any kind of an expenditure, that expenditure must be allocated by the board of supervisors. Because this is an additional allocation and then another $1.3 million, then that needs to be appropriated by the board before we can spend it. To be appropriated, it must be included in the overall budget, not our general budget, but this is just specifically for the CARES budget itself, which is part of our overall budget.
Okay, so we're not modifying our operational budget.
No, sir.
We're just appropriating the use of that, taking the procedures to add it so the county can actually use it.
Yes, exactly.
I got it.
Exactly.
It's really, I'm sorry.
That's okay. It's just based on section 15.2-2, 2507 of the Code of Virginia. When you have that 1% variance that you have to re-add.
Right, my recollection the last time around is we didn't want to put it in our budget, so we didn't trigger that. That's, but I may have faulty memory.
We're not commingling it with our operational budget. We're keeping it
It's still
separate.
because it violates the 1%
Yes, sir.
rule. We still have. Okay,
Yes.
I got it.
So, if you don't mind, go ahead. I think, I may be wrong about what I'm about to say, but I think what Supervisor Fan was saying is the first half of the money that we got, did that trigger us to do what we're doing right now?
Yes, sir.
And we went through that whole process.
We did.
So what we're doing is doing the same process again because new money came in that was not absolutely guaranteed until it actually arrived.
Correct.
Does that make
Doing
sense?
it part of the normal budget process though?
No, we
That's
actually
all
did it
in
in
a
July.
separate public hearing.
It was in July.
Okay.
So I'll look for a motion for the public hearing on the new second deal.
I'll make that motion.
Second.
Motion second, all in favor, aye. Aye.
Thank you.
Thank you.
Thank you.
All right, next to the Grayson County Public School appropriation request.
Yeah, I'd make a motion, we table those two requests, Mr. Chairman.
Okay, we're going to motion to table, do we hear a second?
Second.
All in favor, aye.
Aye.
Okay, county administrative report.
Yes, Mr. Chairman, just briefly, just wanted to let the board know that after discussions with Supervisor Rebels and with our tourism director, Tracy Cornett, we have decided to designate Tracy as the project manager for the Mount Rogers School project. So she's still going to continue to do the work that she needs to do in the tourism area, but she is going to be primarily focused on the Mount Rogers School, getting that work done there. We're very pleased that Supervisor Rebels and Tracy are excited about moving forward on that. The other project manager that we have discussed Carl Caudill being the project manager and focusing his primary attention on providing assistance to our broadband efforts. And he has agreed to do that. And I've spoken with Supervisor Fant about that, and Carl will be filling that role as we move forward. We are still working with the Baywood School technical folks to figure out which of two candidates that we have would be best to bring on board. So that will be an outside person that will be brought in very soon. I think that's it on the administrative report.
Maybe there's a comment.
Yes, well, the first two are already employees,
Yes.
so they'll just be focusing more attention. The third one, the Baywood, would be a contract. Oh, and also, I'm sorry, I was supposed to announce that Wednesday, the household hazardous waste collection and personal document shredding.
No, Saturday. Wednesday's route is when they start up with the large items again.
Okay,
Mr. Looper's already covered that.
okay, he told the, did he say the dates? September 21st?
Yes, that's when Wednesday, that's when the route starts for Wednesday's route. Monday and Tuesday's routes, people that are on those routes have already had their large item pickup. So they won't get another one. We're starting with Wednesday on the week of September 21st. Thursday's route will begin September 28th and Friday's route October 5th. This household hazard deal will be over Saturday, September the 26th, over to Carroll County Solid Waste.
Okay.
And that's where you can take your household hazard waste over there.
That's all I have.
Mr. Shepley,
Yes,
should we inform the board that the Brownfield Group, which is state and federally funded, has approved the School of Architecture and Urban Planning at Virginia Tech to undergo a design project for the old Mount Rogers School, and the Brownfield Group will pay for that, and the total value of that agreement is approximately $40,000.
that is fantastic news. We've been thrilled with the first analysis that they did. It's really moving the Mount Rogers School project forward quickly, and we appreciate all you've done to bring those forces together and make this happen. And the next step of it's going to be even better based on what you just said, Supervisor Rebels.
Well, I think so, and I applaud your decision on letting Tracy focus a good portion of her time on the project, because it will take it. And I have been extremely impressed with her capabilities, Bill. Excuse me, Mr. Shepley.
That's great to hear. I appreciate it.
Anything else? Do we have the rest of the speakers?
Just Kevin Wilmore.
This good.
No.
I didn't sign up. Take it out.
Okay.
Bessie might have, but I didn't. Bessie said no.
All right, no board of supervisors time that I know of. All right, I'll look for motion to go into closed session for discussions related to respective business or industrial, which would be 8.5, and actual probable litigation on legal matters would be A7, 2.2-3711. Looking for motion to go in closed session.
Second.
Okay, I'll look for motion to come out of closed session.
So moved.
Second, all in favor?
Aye.
And poll of order that we discussed nothing other than 2.2-3711 or A5 and A7. Mr. Ash.
I so certify.
Mr. Fan.
I so certify.
Ms. Sutherland.
I so certify.
Mr. Rebels.
I so certify.
And I so certify. So we are back in open session.
We need to open those doors.
Yeah, thank you.
First, I guess we'd do Comcast franchise. Are you going?
Mr. Chairman, I recommend we table the franchise until we get some information that Comcast agreed to provide last month.
Okay. Motion made. Do I hear a second?
I'll second.
Second.
All in favor, aye?
Aye.
Is it okay if I give him a second?
Yeah,
He's not having
He
one all
can
night.
say.
He's too late.
He's hungry.
Throwing the bone.
Okay, next will be the Grayson County Public Schools appropriation. Go ahead.
Mr. Chairman, I recommend we untable those two requests and recommend approve. Make a motion to approve.
Have a motion to approve the request. Do I hear a second?
Second.
All in favor aye.
Aye.
Uh,
There's a weak eye there, Tom. Okay, that was all.
yeah, it
we
was.
had. All we have tables, so I'll look for motion to adjourn.
So moved.
Second.
On favor aye.
Aye.
Thank you.
Come on, y'all. See you, Tom.
Bye,
All
Tom.
right, see you guys. Goodbye.
Mike, did you second that motion to adjourn?